provide the community a quick overview of the pandemic situation as we see it in local government, and certainly from our health officer's perspective, and take any questions that you may have this morning. Joined this morning by Commissioner Josh Slotnick, representing his colleagues at Missoula County, our City County Health Director, Deshane Barnett, and our Director of Emergency Operations, Adrian Beck, who has been at the helm of incident command and pandemic response outside of and in collaboration with Health Department over these many months. And with that, Deshane has some facts he would like to offer this morning to create a little bit of a context for our conversation.
Thank you, Mayor. Yeah, good morning, everybody. So as many of you are probably already aware, because we have been trying to get the word out, we are in an uptick, an upswing. Yeah, I would call it actually more than an uptick. We're in an upswing. And so our epidemiologic profile is ascending. We are going up when it comes to COVID-19. So our daily incidence of new cases by a rolling 7-day average has gone up to 20. And about 3 weeks ago, we were at 3. So that is a significant upswing. We see all of the other epidemiological indicators are going up along with that. So our transmission rate has increased and our doubling time has decreased, which is not a good thing. We don't want our doubling time to get as long as possible. So we and unfortunately, doubling time is assessed on a weekly basis. So as of Monday, our doubling time was at 27 days, which means that if we had if cases maintained exactly where they are now, within 27 days, we would double the number of active cases that we have. And we don't want that. We want that number to be getting much larger and eventually get to where we're having, so we have half the number of cases. So because of that, when you go to the MissoulaInfo.com website and you look at our key indicators, you're going to see that all of our epidemiologic indicators have now been turned from green to yellow. We are in advanced community spread at 20. And then, the goal that we are trying to stay below is a daily incidence rolling 7-day average of less than 25, and we're at 20. So we're slowly creeping up to our threshold that we do not want to pass. And that is where we're at right now as far as incidents. We do still have some good news in that our vaccination rates still lead the state and are still going up, albeit slowly. So we have 61% of the eligible population is fully vaccinated, and 54% of the entire community is now fully vaccinated. Our goal is to have 75% of the full community fully vaccinated. So we are still not at our goal, and we are still absolutely encouraging people to get vaccinated. We are also now dealing with the Delta variant here in Missoula, and we know that this is a strain that is highly transmissible, and our best defense against this is still absolutely vaccines. And I think I'll stop there with where we're at.
Thank you, Deshane. Really appreciate that. And so Commissioner Slotnick and I are here, I think, to suggest a couple of things. So what Deshane just described are numbers that at the beginning of this pandemic threw us all into a panic. We were engaged in all sorts of measures to mitigate, to ensure that we didn't have case numbers like the ones we're experiencing today. This has been a long haul, and I think we all get that. But the fact of the matter is that we are not done with the pandemic. And the difference is, at the beginning of this pandemic, we did not have a vaccine, and today we do. And so I think what you heard from Deshane and what you'll hear from Commissioner Slotnick and from me and from just about everybody in local government is that if you are not vaccinated, please do so. It's very simple. It is, at least in my experience, painless. And even in the event that this contagion, that is the Delta variant, gets you, you're not going to die from that contagion, and you're not going to be nearly as ill as you might otherwise be. So vaccines actually work. There is so much mis and disinformation out there. Vaccines have worked for years in this country, and in many cases have eradicated horrible diseases. And in this case, we can eradicate, or at least get us to herd immunity by taking the simple act of getting a free vaccine, and we can provide you additional information on that. Other moving parts here, we don't have authority to mandate, and frankly, even if we did, I'm not sure we'd be in a position to do that. The mandates that were in place were largely self-enforced. We didn't have the mask police out, and we didn't require it because this community was thoughtful and cooperative and collaborative. And our hope is that we continue to engage in that thoughtful, collaborative activity. As residents, we can do a lot to help each other. Commissioner Slotnick, please.
Yeah, thanks. So I'm just going to reiterate some of the things you just said, Mayor, just because I think it's worth it to put a really fine point on this. And I'm going to step out of my lane a little bit and talk some public health stuff. So please, Deshane, correct me when I get this wrong. If a person had jumped in from some faraway spot and heard Deshane's numbers, a question might arise in this mythical person's mind. Wait a minute, if vaccine rates are going up and incidents of infection are going up, well, obviously the vaccine doesn't work. And I want to respond to this, that the vaccine is 95% efficacious, and getting COVID and getting really sick are really different things. And one of the ways the biggest way right now that the vaccine is helping us is, yeah, you could still get this 5% chance, but you're not going to get really sick and you're not going to die unless you're a member of some very already health burdened person. So there's a ton of reason to get this vaccine. It actually does work. It will keep you from getting really sick, and it'll keep you from possibly from dying. Other piece of this that I want to note is that this variant is what I've heard on the news as 1,000 times more contagious than the previous one. Contagious like the common cold, contagious like the chicken pox, which really means, and please, Deshane, correct me if I get this wrong, but if you're not vaccinated, it's a really high likelihood that you're going to get the Delta variant. And if you're not vaccinated and you get the Delta variant, there's a really high likelihood that you're going to get very sick. So you have every reason in terms of self-preservation to just suck it up and get vaccinated. There you go.
Yeah, and so, oh, sorry, go ahead, Mayor.
No, please, Deshane.
Well, I was just going to say, so there are, and many people don't realize, there are more than 500 strains of COVID, and there's different classifications, so won't get too deep into that. But this Delta strain, what is associated with the Delta strain is a much higher viral load, which makes you much more contagious. And so, and this is what I poorly tried to express last night to MCPS, and I'll clarify, and I'll do that with Rob also. But looking only at case data, just like Josh said, if we see vaccine rates going up and case incidents, case numbers going up, looking only at that, you're not getting the full picture. What we do know is that the vaccines, even though some people may become positive, they are either asymptomatic or mildly symptomatic. And what we're really trying to do are keep people out of the hospital, and then those ones who do need to be hospitalized, keep them from being intubated and keep them from dying. And the vaccines are still absolutely our best tool at accomplishing that.
So thank you, Deshane, and thank you, Commissioner. So just a quick reminder, our goals today are similar, in fact, likely the same as they were when the pandemic started. We want to make sure that our hospitals and our healthcare system remains viable for people who are suffering from other ailments. We want to make sure that we prevent death and human suffering. And again, the difference between today and the first time we began talking with our residents about this pandemic is that we have a vaccine in place. We have incident command ready to stand up. We are prepared in the case that these numbers increase dramatically as we proceed. Our hope again is that people will step up and take care of themselves and one another, and we won't need to go full incident command again. But the only way to get there is if we work together, and that's really what we're trying to suggest to you all today. Is that it's up to you, and we need your help.
So one thing I would love to add in here is if somebody's thinking about how do I take this information and apply it to my own behavior and what I'm doing in my own life. And again, Deshane, correct me as I slip out of, if I get it wrong in terms of public health, but if you are in small groups of people that you know to be vaccinated, I'd say my take is you don't need to wear a mask. You're together, unless someone in that group is connected to a child or someone else who's really health compromised. Where you might want to be more cautious is if you're going to be in areas of confined airspace with large groups of people, then you might want to think twice. Definitely wear a mask, and also be conscious of transmission rates. So if you're going to a place with high transmission rates, be really careful. If you're in a place with low transmission rates, you don't need to be as careful. So having some contextual awareness rather than kind of a blanket statement would be the way to go.
Yeah, and Commissioner Slotnick might remember better than I think it was 2 months ago, maybe, the Board of Health in passing its final resolution regarding to mitigation measures, asked people to follow CDC guidance, and CDC guidance has been updated so that fully vaccinated individuals, yes, when you're out in public spaces, and again, like Josh mentioned, if you're going to be, not able to maintain 6 feet of distance, and these are not people in your pod, these are not, people that you live with or work with, all of those same behaviors that we learned last fall are still important to employ. So, masking, using social distancing, sanitizing, frequent hand washing, all of those behaviors absolutely still apply. And one thing that is going to change based on CDC recommendation that some folks, might be like, oh, wait, that's different than how it was going, is that if you have been fully vaccinated and you are a close contact of somebody who has tested positive, if you are asymptomatic, you still do not, we will not put in a quarantine order. But what we will ask you to do is 3 to 5 days after you've been notified to go and get a COVID test so that we can try to monitor the amount of people who are asymptomatic with the COVID virus. So that is a change in practice that's being recommended by the CDC, and the health department is going to work. That just came down the line, so we're going to work to figure out how we're going to make that happen here in Missoula. But we do want to still be checking that even though you might be asymptomatic, are you still carrying the virus? So that's a change that will be coming up.
Thanks, Deshane. And would you be so kind as to remind folks 2 things? One is where you can get vaccinated, and 2 is where you can get tested.
Yes, so our vaccine clinic at the mall site, which is many people know as the Old Lucky's, is open 7 days a week. And so you can get vaccinated. Most people, if you have not had an adverse reaction to a vaccine or don't have significant health concerns, most people are in and out in less than 30 minutes. No appointment needed. We appreciate when you make an appointment, please feel free, but no appointment needed. So, our staff are working hard to get people in and out of there. And then as well, we are actually trying to make it so that getting a vaccine is not a barrier, that we are making it as convenient as possible. So if you check the Missoula County website, we are offering mobile clinics throughout the summer where, if you're out and about, you can swing by our mobile clinic, get your vaccine, and just get on, with the rest of your day shopping, if it's at an event, having fun, whatever it is that you're doing. And then our testing is still taking place at Flynn Lane. And then I apologize, I was going to try to type real quick, but I don't know the hours for that. But you can go on to our website, MissoulaInfo.com, and all of that information is there. Adrian, sorry, did I get the website correct?
Yes, you did.
And remember, the other thing that's changed is, well, one thing that hasn't changed, if you have a primary care physician, do not hesitate to reach out to your doc and say, hey, I'm feeling puny, or I just want to get tested. And your primary care physician can take care of that for you as well. They can also help you with the vaccine if you don't need, if you're not inclined to pop into Lucky's. Tests are now all over the place. You can buy a box at a pharmacy and test yourself if you have the courage to stick something that far up your nose on your own. You can get that done as well. I'll leave that to the professionals to make me cry when I get a test. But all right, with that, unless Adrian, you have anything to add, we'll go to questions.
You know, the only thing that I would add is just from the emergency management perspective, we stand at the ready to kind of scale and flex as needed to address community outfall from the increasing cases. We're in a different place than we were when we started this pandemic. As folks will remember, we had limited PPE, we did not have testing capabilities, and we certainly didn't have a vaccine. And while the landscape has changed, I think that we just need to encourage people to pay attention to their surroundings, to pay attention to who they're hanging out with, and to take necessary mitigation measures to protect themselves and their families. But we're paying attention, and we will continue to check in with our elected officials and our health officials to determine what level of response is necessary.
Thank you, Adrian.
Sorry, Mayor, can I hop in one quick thing?
Absolutely.
Because I realize not everybody likes to use the internet. So in addition to MissoulaInfo.com, you can also call 258-INFO.
Great. Thank you, Deshane. All right, with that, happy to open it up to questions. And I might ask Allison if you would manage that for me, because I'm not used to moderating meetings in Teams.
Sure thing. Members of the media, if you just want to use the raise hand function, I think that's the easiest way to do it. And I'll try to keep track here of who's got their hands up.
Thank you.
See, Jordan Hansen's got his hand up.
Jordan, please.
Yeah, excuse me. Yeah, I guess one of my first questions would be, and this might be more towards Deshane, but it's sort of a legal question. But do businesses, legally have the ability to tell their employees to wear masks, to enforce that mask mandate within their own business? That's a question I've got a couple times, and I was just hoping for some clarification on that.
As far as I know, yes. I am not an attorney, and so Josh, John, if you've met with attorneys who have given you any better information, as far as I know, a private business can still absolutely decide what happens within that private business.
I believe that to be true as well, and I'll offer the disclaimer that I'm not an attorney either.
Yeah, then Jordan, that's my sense of it. It's your business. You can make your rules.
Gotcha. Thank you, guys.
Other questions out there? Peter.
Yes, thank you. I can't believe how many times I'm getting this question. But President Biden recently said, hey, we're going to give $100 to anybody who gets a vaccine. And I reached out to the county and they said, no plans yet in Missoula anyway. So I was wondering what the status is, because I still get questions about it.
Unless, Josh and the commissioners have heard different, I have not heard any information yet that would filter from the federal government to the state to us saying that funding is being made available. So I have not had any communication about doing that yet.
That is correct. I'm awaiting a package full of crisp hundies, and we'll begin to hand them out if they arrive. But until then, no. Yeah,
and I actually didn't hear the question, but now I've been able to infer. We're not in a position today to be handing out $100 bills for sure. One of the things that I will mention, however, and one thing that remains a concern for us is the number of folks in kind of the 20 to 40 age range who are either not vaccinated or not fully vaccinated. That seems to be where we're epidemiologically, that seems to be where we're seeing a predominance in cases. So if you're just slightly younger than I am, I would ask you to think hard about getting a vaccine as well. Peter, your hand is still up if you had a follow-up.
No, thank you. I appreciate your help. Thank you.
Thank you. Are there any other hands that I missed?
Freddie Monares from MTPR.
Thank you. Right. Go ahead.
Thank you. Yeah. Can you guys hear me okay?
We can.
Yes.
Perfect. Awesome. So I had a few questions. Thanks so much for holding this virtually too, by the way. First question is to Deshane. I was wondering, you talked about some changes happening soon for people who are close contacts that have been vaccinated, that they'll have to get a coronavirus test 5 days after. When are those changes going into place?
So, and this is a recommendation, so we can't force them to get tested, but we're going to ask them to get tested within 3 to 5 days after we notify them. And what we are doing, that's a new recommendation that came down from CDC. So what we are doing right now is looking at our available test supply, and then we're going to plan out and begin ordering to meet that need based on the case numbers that we're seeing right now. I would expect that we will likely have that in place beginning sometime next week, realistically.
Yeah, and as far as testing supplies concerned, is there any concern over that right now? Are we doing okay on testing supplies?
Yeah, right now we are doing okay. What we've seen is that, as the vaccine has become more widely available, testing has gone down. So we haven't had a need to keep as many testing kits on hand because, we want to make sure that they're available for other jurisdictions that need them, that they're not, expiring, going bad. So we just need to make sure that we ramp up as far as our supplies. I do not, and I have not heard, so I don't expect and haven't heard of any challenges related to getting tests.
Great. And then do we know how many positive tests are being tested for variants from Missoula County?
So the last notification that I had from the state lab, they are testing 100% of positive cases for variants. A caveat there is that is not actually made available to us and to the provider and the person who tested positive for treatment, that is purely for epidemiological surveillance. And so we'll get a report back saying of the positive cases that you reported this day or this week, this is the number that had this strain, that strain. They are not linked back to the individual.
So Deshane, do you know, I'm pretending to be a journalist now. If someone gets a test done, but not done through the county, would they be able to find out if they have the Delta variant or not?
No. So even if they get it, the test done through a private provider, through one of our FQs, they're all, for the most part, and I guess I shouldn't say it's a blanket no. Most providers in Missoula County send their tests to be processed by the state lab. The state lab does the variant testing, and then, like I said, they send that data back aggregate to the county.
Thanks.
Freddie, did you have more?
Yes, I did. Thank you, Mayor. I just had one last question. I was wondering if, like today's meeting, are the city and counties planning to go virtual meetings in the future?
So we have for the time being, we have established a hybrid model for council and council committee meetings. And for the time being, we are going to revert to all virtual until we see some epidemiological indicators that suggest it's safe to do otherwise. Josh, what are you guys up to? Commissioner, what are your plans
Oh.
around hybrid meetings?
I'm having some bad network issues here. Sorry. For the time being, we're going to stick with our hybrid model, and we'll just keep an ear on things and see how it goes. Sorry, everything froze up for me for a moment.
No
Back
problem.
at it.
No problem at all. The county typically is a little late paying their internet bill, ladies and gentlemen. The city, we take care of that on a weekly basis, so just making you aware. Freddie, did we get all your questions answered?
Yes, thank you, Mayor. And there may be more later, but for now, I'm done.
We're
Thank you.
here.
Great.
Freddie, you've
George?
been doing a great job lately. Appreciate
Thanks,
it.
Josh. Thank you.
I'll go further, Freddie. I think you've always done a great job. I don't know what Josh's caveats are, but Jordan.
Thank you, Mayor. I just kind of had one kind of a two-part question, and more for Deshane, I think. For the Old Lucky's Market, the vaccine clinic, what's kind of been the weekly uptake on that? And then thinking about the mobile clinics, how successful have those been? Do you have some kind of general numbers of when you guys do go out and do those mobile clinics? What does that kind of look like?
Yeah, so for the first question, recently, so especially last week, our vaccine numbers have actually doubled. Our vaccine numbers weren't, like I mentioned, where we wanted to see them anyway. So even though they've doubled, they're still not where we want to see them. So we were averaging, if you look a few weeks ago, we were averaging about 50 vaccines a day. Last week, we averaged about 100 vaccines a day at our Lucky site. For the mobile clinics, it's really been hit and miss, where, we've had some where maybe only a handful, 4 or 5 get vaccinated. Others, 30, 40 get vaccinated. Because we are walking the walk behind our talk, we are making vaccines available. So if we, suspect that, an event is not going to be, very, busy and we might only have 2 or 3 people, we are not going to say no, because that's 2 or 3 people that we want to have vaccinated. And the mobile vaccine, they have it down so that it's really smooth. They go out there, they know what they're doing, and they get the job done. So I don't have numbers for mobile vaccine. I can absolutely get those. So say like for, the last month, I can see how many were done through the mobile. I would say that though, it's really hit or miss based on the event as far as how many we get.
Gotcha. And then when you say 50 to 100 at Lucky's, is that first and or is that just is that the combination of first and second doses?
That is a combination. That's just doses.
Gotcha. And then I did actually just have one other question too that I just thought of, but one fear I think for some jurisdictions around the country is that the vaccines might expire. I can't quite remember what the expiration date, how further back those go, but I just didn't know if there's any worries of vaccines going bad or being wasted or anything along those lines.
For the Missoula City County Health Department, that is absolutely not a worry. So we get it's an inventory report. So we see exactly, I see, as well as the staff, exactly how many we have of each of the 3 different brands of vaccine. And we are scheduling it out to make sure that we are not losing doses as far as, they come in vials, and once you open a vial, you have a limited time. And so we schedule out to make sure that we're not losing doses and that we are not hitting any kind of expiration. And the way we do that is if there really looks like we're not going to be able to use it, we start calling other providers, first in Missoula and then in the surrounding counties, and we get those doses out to them so that no single dose is wasted. Missoula City County Health Department is not the only one administering doses, so I can't speak for, like CVS, any other private practitioners, but for the Missoula City County Health Department, ours are absolutely going to use.
Awesome. Thank you so much, everybody. I do appreciate it.
Freddie.
Yeah, just sort of piggybacking on Jordan's question, are we tossing out any expired vaccines or anything like that? Just to kind of clarify.
Missoula City County Health Department is not. Unfortunately, I can't know the supplies of other providers in Missoula County, but the Missoula City County Health Department is not.
Great, thank you.
Other questions? Are there other questions? I can't quite tell. All right, well,
Doesn't look like it.
thank you, Allison. So seeing none, any final words of wisdom from DeShane, Commissioner Slotnick, or Adrian?
I said this before, but I think it's worth saying again. If you are eligible for a vaccine and you choose not to get one, there's a really high likelihood you're going to get sick and get very sick.
And from the health department, yes, what the message that we want to send is that vaccines are still absolutely our best and most effective tool in combating COVID. And then also reminding people of all those other individual mitigation behaviors that we've learned over the last 16 months. Just keep all of that in mind.
Well, I can't add anything that my talented colleagues haven't already said. Once again, really appreciate you all joining us this morning for this quick conversation. Thanks for all of your assistance in getting accurate information out to the folks we serve. I'm grateful for that. Everyone, please stay safe and take care.
Thanks, everybody.
Great. Thank you.
Thank you.